people that I meet and I tell them that I work for HSS, they say, wow, that must be such an interesting job. I say it absolutely is.
I take home the fact that I'm here to help people. I really enjoy doing that.
Just the idea that I can serve different variety of people and just be able to present them with customer service that they may not receive anywhere else.
Thinking on your toes, constantly, every day is a new challenge.
At the end of the day, I go home knowing that I've accomplished something.
HSS was originally founded as Midtown Hospital Association by 7 Denver hospitals. Over the years, we've grown through references and referrals through our employees providing great customer service. We currently have operations from Florida to Oregon, from California to Colorado. We've grown very steadily over the last 40 years, and through the efforts of our team members in providing world-class customer service, we continue to expand and currently have 2,400 employees.
When we think about working inside of a hospital and working inside of healthcare in general, we have to realize there's one unique differentiator that in that location more so than any other. That is, we work with patients frequently and often. We're in a care environment where people are there to have healing occur, and they're not always because they want to be. So we need to have people who have empathy, who have a care for the other human beings. We also realize we serve a very strong customer service role, and that role means we are a walking around answering machine. We have people coming to us and asking us questions frequently and often. But there's also times when we have to have folks who have a strong presence, who will be able to de-escalate a situation, not because we're dealing with a lot of upset people, but because we are dealing with people who are not always in control of their mental faculties or other situations that bring them to the healthcare setting in the first place.
You'll get the days where it's high speed, it's non-stop, and you've got to be on your toes. You know, you've got to be able to tell your officers where they need to go, work with medical staff and management as well. So when everything goes off without a hitch and you get through it all and everybody gets through it safe, at the end of the day you feel very satisfied and fulfilled. Exhausted, and the adrenaline is just great.
The interaction and how we deal with each thing on a day-to-day basis is the beauty of it. You never know what you're getting into, but when you get there, the training that we've taken up thus far definitely keeps you prepared for what you're about to face.
Pillar number 2, image of excellence, has to do with our image as the security profession in healthcare security. This is very important in the hospital setting, that we project a good image, that we look the part, that we know the part, and that we execute with excellence at all times.
Love working here. Love working in hospitals. It gives you a real chance to get a feel for the people. You know, be out every little bit, every option you have to do to go out of your way. That's what I like about this job.
A lot of the patients that I deal with, if I come in the morning, I relieve officers that are out at nighttime, and unfortunately our officers are dealing with sleeping patients, so I keep dealing when they're up. A variety of patients that either have alcohol coming on in that do not know where they're at, confused, and psychiatric patients that, you know, are unfortunately aren't cohesive and can't take care of themselves, so we have to assist them and make sure that they're safe and secure.
It's a constantly changing environment. Our clientele differs every day, and because people are coming here under emergent conditions, traumatic conditions, we're dealing with serious events at all times, and it can actually be a rather dull day and go to a crisis within seconds. And so you've got to be able to react at any time and be able to give the level of service at any time.
The passion for me is working within a healthcare environment, working within an organization where myself and the other folks that are on our team are very much invested in the organization. They're very much a part of the organization, and they have an interest in seeing it succeed.
At the beginning of the shift, we check in with our house supervisor, make sure that there's nothing going on from a clinical standpoint that we don't already know about. There's a lot of things that happen without our knowledge that we don't need to concern ourselves with. But as far as security goes, it's a very, very vital part of what our hospital does during the day.
Training at HSS, it is a pillar of our long-term success, and it's been at the heart of what we've done and specialized in the healthcare security arena for years. But training at HSS is not a one-time event. It begins when you first start with HSS. We're going to make certain that you're going to feel comfortable and have the confidence to succeed as a security officer, but we're going to periodically bring you in, whether it's classroom, computer-based training, working with your supervisor, working with our trainers to help make certain that you have the skills to be successful as a security officer.
Training was very thorough. They explained why we do what we do instead of here, just do it.
The training that we receive is absolutely spot on. We don't have anything that's unnecessary, anything that we're forced to go through that everyone doesn't enjoy. We have a lot of people that really enjoy the job that they do. They care about the training that we get and are very involved and passionate about the training.
The overall culture of HSS is customer service focused, but to really deliver world-class customer service, we recognize it's the employees who are delivering that service. So there's a strong focus on seeing our employees have success. That success begins with who we're bringing on to be a part of an important team, but also we recognize that training is such a critical component to the individual's success. And we recognize that working in a hospital and a healthcare setting is not something a lot of people come to us with. So our training programs are established and built to make those individuals successful. How to work in a healing environment, how to interact with patients, and recognizing the unique differences that that environment presents.
Within a healthcare setting, teamwork is critical. With the mission of our organizations, the mission of a healthcare organization, teamwork is critical. And as HSS, as an organization, and employees that we're trying to bring on board, we're looking for people that have a teamwork focus and the people that have worked on a team and understand the intricacies of a team. Because healthcare is very much teamwork focused. And if we're going to accomplish our mission, which is to serve our clients, our employees, the employees that we bring on board, have to have a teamwork focus.
With HSS, there's a lot of team environment involved. They're willing to help me out with if it comes to family or with some other situations. And then with the hospital setting, you work really closely with your officers, so depending on them to have your back and to depend on the medical staff that you work with is very key.
We have a very vast patrol here at the campus. There's many areas that constantly need supervision and checking in with all the nurses, checking in with the patients, the families, seeing how everybody's doing, just being very proactive with what we do here at the hospital.
The HSS iLead program is focused on building our leadership skills with our supervisors, with our managers, with our executives, but also with our officers themselves. It's a program really designed to help build and prepare our employees to take the next step in their career path.
The benefits are amazing. You get the health care, you get the dental, you get the vision. Another really important thing to being a security officer is you got to keep in shape, and they also have a program through Bally's that you can utilize to keep in shape and be able to do your job, and that is really important. You know, being a woman in security, obviously starting a family is important, and they're really great with that leave and being supportive enough to allow you to be a mother and also to work in an element like this. So it's great.
I've been with HSS since 1985, and we provide great world-class customer service to our customers. We create great environments for our employees. We work hard, but we also make sure that we balance our work with great fun and work very hard to create those great environments for our employees.
HSS has a strong commitment to advancement and promotion from within. It is one of our pillars, and I could tell dozens of stories of people who have come into our halls as security officers. Myself coming in and seeing the promotional opportunities that have been presented, as well as looking at the opportunities that this organization has and presents to those who really want to make healthcare security a career. Those advancements come from being a shift supervisor to working at and leading a site, to running an organization that has multiple site locations, to working in our corporate office staff. We are an organization that is committed to promotion from within.
I'm here to represent two entities, HSS and University Hospital. I take home the fact that I know that I've been here all day helping out people. People come here very stressed and upset, and they typically It makes me feel better to know that I've made their day just maybe a little bit better in a stressful situation.
Well, I've been with the company since 2005. I really enjoy the atmosphere that our company provides. I enjoy the stability. I enjoy the people. Every person that I've had the opportunity to work with has always been a pleasure, and at the end of the day, I go home knowing that I've accomplished something every single day.
Anytime you say the words HSS, especially around a hospital, they're like, oh, well, I've seen you at other hospitals, but it really makes you feel good when someone says, well, I feel comfortable with you, I feel safe with you, and they just see, they call the officers blue shirts because there's so many of us, but when they see one of us, that they feel comfortable, and that makes me feel a lot comfortable with somebody else, that some patient or visitor feels comfortable with me around them and they feel safe.